Leader of the third party.
Thank you, Mr. Speaker. For years in our province, patients with complex health conditions leading to debilitating pain and fatigue have struggled to find appropriate care. Given the demands on family physicians, it's often difficult to get a diagnosis, never mind treatment. Based on Bowen Island and the riding I represent, the BC Centre for Long COVID, Myalgic, encephalomyelitis, chronic fatigue syndrome, and fibromyalgia became a lifeline during the pandemic and currently serves 6,000 patients across the province. This innovative multidisciplinary model of virtual group medical visits is under threat of being curtailed as of January 1st, reducing group sizes to the point where the model is no longer viable. Virtual group medical visits are efficient, cost-effective, and save the health system money, over $2 million a year, according to an analysis by accounting firm MNP. Mr. Speaker, we know the healthcare system is in crisis and health spending represents roughly a third of the government's budget. So why is the minister not supporting models like this that are proven to both increase care and save costs?
Minister of Health.
Thank you so much, Honourable Speaker, and thank you very much to the member for the question. First, I want to say, group medical visits are a really important way of supporting people who are living with some very complex conditions and often debilitating conditions like long COVID or like chronic fatigue syndrome. Mr. Speaker, and these are models that are helping patients get more time with care providers. It's enabling them to stay at home and access care. It's a way of improving support and continuity for care. Now, during the pandemic, the temporary measures, these were temporary measures that were introduced to expand access to virtual care. And in this post-pandemic era, the Ministry of Health has been working with Doctors of BC to strengthen virtual care visits, but also to be able to design fee codes that are a way of supporting care by setting some limits on group size and clarifying the billing rules. Mr. Speaker, I have heard from members of all sides of this House, I've heard from physicians, I have heard from patients about the benefit of these group medical visits, and that's why we put a pause on a decision that had initially been taken, and we are working and hearing from providers, from patients, and I'll have more to say about this soon. I understand that people are waiting to hear an update. Thank you.
Member supplemental.
Thank you, Mr. Speaker. I appreciate the pause, and I'm asking this question now because people are trying to plan their lives beyond January 1st. So unless the minister acts soon, the clinic will need to reconfigure on January 1st to do more non-group patient visits, which will add to wait times. Smaller group sizes mean physician-only care, which restricts the volume of patients who can be seen. Some patients will be forced to seek out care in emergency rooms, from family doctors, and from specialists as a consequence of reduced clinic care. This will severely disadvantage rural and remote patients and those bed and housebound by disability. Patient volumes will be restricted at a time when complex chronic disease patient numbers are on the increase. So will the minister intervene with the Medical Services Commission to do the right thing and modify the group size cap to allow these expert practitioners to continue to help these patients in need?
Minister of Health.
Thank you so much, Honourable Speaker. The member's done a great job of describing why these are of benefit, and again, expressing some of the interventions I have heard directly from physicians and from patients, from other care providers. That's why we paused on the decision. That's why we are consulting directly with Doctors of BC and hearing from other care providers. That engagement is important so that we can make a good decision moving forward, Mr. Speaker. I'll have a lot more to say on that in the future. And again, I just want to acknowledge, I understand people are waiting to understand what the decision is. But at the heart of this, again, is we understand group medical visits are really helping people, particularly those who cannot leave home, those people who are living in remote and rural areas, and it's important to be able to continue these. Thank you.